So let's talk about NSAIDs. This lecture will be going to a series of lecture. Okay, and I'll talk about different types of NSAIDs, the classification, how the NSAIDs are different from other different types of NSAIDs, when to give them, and all other things related to the NSAID that you need to know. So before going to the NSAID, the NSAID refers to non-steroidal anti-inflammatory drugs. Now these drugs are non-steroidal, so we must know that there is one category of drugs which act similar to the NSAIDs, but this NSAID is non, and that is a whole different group, which is called particularly the steroidal drugs. We will cover that some other day. And NSAID is anti-inflammatory. Okay, it decreases the inflammation. However, there are also two other things that we need to know along with anti-inflammatory property of the NSAID, that it is also antipyretic and anti-analgesic. Right, so whenever we talk about some sort of NSAID drug, we try to differentiate all those drugs on the basis of these three main properties. So NSAID, non-steroidal anti-inflammatory drugs, however, it also cover antipyretic property, anti-analgesic property, and the anti-inflammatory property again. So before knowing the NSAIDs in detail, we must know about the arachidonic acid pathway. Why these three properties are important, where these three properties come from, right? We already discussed it in our previous lectures that whenever the arachidonic acid breaks down, it gives us prostaglandins, right? Prostaglandin E2, thromboxane, I2, and everything. All of these chemicals were responsible for causing inflammation, right? For the inflammation, we discussed about Ruber, Kyler, Dollar, tumor, and loss of function. So inflammation, right? So first was inflammation, then it was causing the sensitization of the nerve, which was causing the pain, which was giving us algesia, right? So our prostaglandins, right, it was giving us three main things. It was giving us algesia, it was giving us pyrrhia, and it was giving us inflammation. And to tackle all these three things, we gave the patients NSAID, right? NSAID is the option. Now let's first try to classify these drugs. What the different types of classification system in it. There are about 24 drugs in this category, right? NSAIDs classification. This classification is very, very important for us, right? There are about 24 drugs in total. Out of 24, we need to understand about like a few of them. Let's see all these drugs step by step. So overall, these drugs are classified in 4 different types. Okay, first of all, let's break it down over here. It's a non-selective COX inhibitor. Then there is preferential type. There is preferential COX inhibitor, and then there is particular one, selective COX-2 inhibitors. And so this was preferential COX-2 inhibitor. And lastly, there is analgesia, antipyria with poor anti-inflammatory property. Right. So this is the main 4 classification. Out of all these 4, the biggest group is the non-selective COX inhibitor. So we have already just said there are different types of COX inhibitor, right? Let's come over here again. We already discussed that there were different types of COX. There was COX 1, there was COX 2, right? And there's also hypothetical COX 3. In this lecture, we'll focus more on COX 1 and COX 2, even in particular COX 2. All those drugs which target non-specifically act also on COX 1 and on COX 2. So it targets both, right? And when it targets both, it completely shut down the pathway of COX pathway, right? So there will be no to about very less PGE2, D2, F2 alpha, thromboxane A2 and I2. However, there will be still production of leukotrienes in this pathway, right? So non-selective, it affects both COX1 and COX2 are inhibited, right? This is a big category, right? So let's start from here. First group is salicylate group, and most common one that we know is aspirin, dispirin, ecospirin. There are different examples of aspirin, right? The second one is the propionic acid derivative. Propionic acid derivative. If you can remember the class name, that's fine. If you can't, that is even much more better. In this category, ibuprofen, naproxen, ketoprofen, and lastly flumbriprofen. So this category, the profen category, right? Let's write it over here. It is a profen category. All of them last suffix is profen. Right. The next one is phenamic acid. Phenamic acid derivative. Only one drug in this, which is the mefenamic acid, very most commonly used in females as meftals drug. Alright, we will study all these drugs in much detail in upcoming lectures. Next group is enolic acid group. Enolic acid group. In this, two drugs comes, piroxicam and tinoxicam. Right, it is xecam, right, as a suffix. Next one is acetic acid derivative, and these three drugs come, ketorolac. I will also tell you the uses in the next lectures. Indomethacin. The main focus of this lecture, just know that these kind of drugs exist, right, and in which category it belongs. And lastly, nabumetazone. Next one, the pyrazolone derivative, right? Then it is phenylbutazone. Butazone. Next one, oxyfen butazone, and lastly propyphenazone. So suffix as azone, right? So this was the non-selective type. It was affecting both COX1 and COX2. In all of them, what we use most commonly, we use aspirin, we use ibuprofen, naproxen, we also use mefenamic acid, piroxicam, ketorolac, indomethacin more, and over here the propyphenazone. Right, now let's talk about the preferential COX2. It affects more COX2 but also a little bit COX1, right? So it contains nimesulide, then diclofenac, is clofenac, meloxicam, and etodolac. In this category, at least three we must know: nimesulide, diclofenac, aceclofenac. Okay, leave the other two. Next category. Next category is celecoxib, etorecoxib, and lastly the parecoxib, suffix as coxib, coxib. And among all these three, at least two we must know: celecoxib and etorecoxib. And last, the most commonly prescribed drug for this category we already are familiar with, which is the para-aminophenol derivative, and over here the benzoxosine derivative. No need to remember the class name, just remember the drugs. In this category, are most famous, most commonly used, most abused is paracetamol. Paracetamol, also abbreviated as PCM, also called as acetaminophen in other countries. And for this category, nifopam, right? And we need to know at least both of them, okay, over here and over here. So let's count how many drugs we need to know. Aspirin: 1 2 3 4 5 6 7 8 9 10 11 12 13 14 and 15 drugs. So out of these 24 drugs, at least we must know 15, right? No need to worry about all these things. I will make it very simple for you to understand. And then also we will learn about in particular for the analgesia, right? For this thing there is analgesic ladder. We start, let's say it is a ladder, and depending on the person's pain, right? So pyria was for fever, analgesia was for pain, and inflammatory was for inflammation, right? So analgesic ladder start from step 1, step 2, step 3, and step 4. So step 1 start with the NSAIDs, and as we go up, the power of drug to tackle the analgesia increases to tackle pain, right? So depending upon the person's pain intensity, whether it is so much or so less, we can use from any of it, right? It's not necessary that you start only from the step 1. You can also directly jump into the step 2, right, or the step 4, but this is the sequence, right, of pain management. So we start with NSAID, then we go with the poor opioid, then some other non-medical stuffs, radiotherapy, exercises, yoga, whatever. And step 4 is strong opioid, fentanyl, morphine, such type of drugs come over here, right? So if a patient has so much pain, you can switch in that ladder. So this analgesic ladder is important for us. Let's say we gave some strong opioid and the person start to deteriorate, come down in this ladder to tackle the pain in this kind of scenario, right? Or you just see some sort of side effects, come down the ladder, right? So this was all about the NSAID classification, right? Paracetamol, aspirin. We will discuss all of these 15 important drugs in much details, how to give them, when to give them, how they differ from each other, in which condition we need to choose which one, and so on. So it's a huge list of everything. We will also try to differentiate them on the basis of their potency, which one is much more powerful, which one is less powerful, right? What are the side effects of all these things? One major side effect was that in this pathway we discussed about stomach, right? The lining of stomach over here, right? How they act and deteriorate the stomach lining and causes the bleeding. So gastric bleeding is very, very common, right? So gastric bleeding, so which one causes huge amount of gastric bleeding, which one has a higher risk to cause bleeding, everything we'll discuss in the upcoming lectures, right? Right, so NSAID classification for you, important stuff.